so I'm gonna first start by checking my orders to make sure that this patient has transfusion ordered, and it looks like they do. And then they make sure that they're type and cross-matched, which says this is emergency. We haven't done that, but it has been sent to the lab, and we're gonna be giving them O-neg blood because of that, just since that's the universal. Also going to check my consent form. Looks like it is all filled out and the patient agreed, so that is perfect. So now I'm gonna go into my room. I'm gonna do some hand hygiene, put on some gloves. Hey, knock knock. Hi Darius, my name's Hannah. I'm gonna be your nurse today. Can you confirm your name and date of birth for me? Perfect, that's what I have as well. So it looks like you have a GI bleed, so we're gonna be giving you a blood transfusion. Have you ever had one before? No? Okay, well then some things I want you to be looking for. If you have any reaction to it, so that's gonna be like shortness of breath, any hives or rash, swelling, fever, chills, I want you to tell me immediately. But if O-neg blood, so hopefully we won't have that problem. You did sign our consent form, so I'm gonna take your vitals real quick. I'm gonna do your heart rate, respiratory rate, blood pressure, O2, and then I'll take your temperature, and those baseline vitals look great. I'm going to flush your IV, make sure it is patent. We have 2 large bore IVs in you, just because it's a lot better if we have 2, so we don't have to poke you again. And if anything goes wrong, we have an extra one. So I'm gonna take a look at this one, and it looks good. I'm gonna flush it. Whoa. I'm gonna scrub the hub first before I flush it, so we don't get any bacteria. I'm gonna scrub it for at least 30 seconds. Okay, now I'm gonna flush this. Perfect, it is patent. So now I'm just gonna check you for any fluid overload. So what that means is I'm gonna see you don't have any jugular vein distension, this is amazing. I'm gonna check your feet real quick. Okay, you don't have any edema or swelling in either legs, and your pulses are equal and bilateral, so that's perfect. I'm gonna listen to your lungs real quick on the front and the back, so just take some deep breaths for me. Perfect. Okay, that's sounding good. Get your back. Thank you. Perfect, checking these different spots on the back. Okay, your lungs sound great. Thank you. Perfect, so it looks like everything is good. Your doctor did order some medications for you, so we're gonna get those started on this other IV. We wanna do those about 30 minutes before, just so they can be in your system and be ready to go before the blood transfusion starts. So, if you're all good, I'm gonna go grab the blood and going to take off my gloves and perform hand hygiene. Perfect. And I'm gonna take my patient's picture. Okay, I'm at the blood bank. Hi, blood bank. I need blood for Darius Hassan.
Okay, I have Darius Hassan.
His birthday is 8/10/XXXX.
8/10/XXXX.
Perfect. His number is 92 541 367. Perfect. And I'm getting some O-neg blood for him, and his blood type is A positive. Is that correct?
Blood, A positive location. Yep.
Perfect. Okay, and then I have the expiration date as XXX.
XXX.
Perfect. Thank you so much. I'll take that. That's okay. I'm also gonna take this to fill out. Okay. I'm gonna grab some more gloves to put on. And come back into my patient's room. Knock knock, hi Darius. I'm back with the blood. We gotta get this in within 30 minutes of getting it from the blood bank. I'm gonna provide some privacy for you, of course. I'm gonna call in another nurse just to check the blood, make sure we have everything right for you. So I'll call in my other nurse. Hi nurse. So I have Darius Hassan here,
Darius Hassan,
His birthday is 0810XXX.
0810XXX,
Number is 982
982
541
541
367.
367.
Okay, and if you'll check this against the back for me, I have 007
007
0134.
0134.
And I have that this is O negative,
O negative.
and that expires XXX.
Correct. XXX.
Okay, does it look like it has any problems to you? It looks clear to me.
Nope, no bubbles, no cloudiness. Looks good.
Okay, that doesn't have an odor either. Okay, now that we have this, I'm gonna get your line all started. So we're gonna get all our tubing ready. This is the fun part, Darius. Okay. And it's gonna fill this chamber. Close this real quick. Making sure all my other lines are clamped. We're gonna wanna fill this so it's above this line in the chamber. I'll open it. Perfect. Hello. Perfect. Okay, I'm clamp everything and get our blood, but first I'm going to connect this to you. So this is just normal saline, and we just have this so that the line is clear. I'm going to clean again by normal saline. I'm going to scrub your hub, making sure that I keep this one sterile. I'm going to connect it. Perfect. This line. I get the, well, nothing's going in you right now, so. But I'm gonna get your blood connected, and again, like I said earlier, we only have 30 minutes to get it in. Okay, so I'm gonna open this line to the blood. We're gonna let it kind of move in kind of fast here. Okay, I'm watching as it gets to my patient, letting it flow through. It's wants to be slow for us today. Okay, at this point it would be up to my patient, so I'm going to slow it down to 2 milliliters per minute for the first 15 minutes. And I'm just going to be waiting with my patient, making sure that they're not having any of those things I was talking about, any of the itching or swelling or hives. And it looks like first 15 minutes were good. I'm going to check the vitals again. Looks like everything is still baseline, so we're going to turn it up to what the doctor ordered. And we have 4 hours to get all of this blood in. So I'm just gonna keep watching with my patient. Okay, and then when my transfusion is done, I'm gonna make sure everything is clamped. And I'm gonna start saline again so that it can flush all of the blood, make sure they're getting all of the blood. Had they had an adverse reaction, I would have stopped the transfusion immediately, clamped it, gotten some normal IV saline running through the other arm, notified my provider, and then I would take all of this and make sure that I take it to the lab to get tested to see what was wrong. But since that didn't happen and we're good, oh, now it flows. I don't understand. This one's closed, this one's open. It should be saline right now. I don't know why it finally decided to be, but as you can see, it's getting wider, so saline is flowing. I checked her again at the end of the transfusion. Vital signs were amazing. I'm gonna let him know that you can still have adverse reactions. So we're still really wanting to watch for those things. And then after an hour, after it finishes, I'm gonna come and take your vital signs again and check your respiratory rate and your fluid overload, and everything looks great. So you're gonna go home. If anything happens, just make sure to come back. I'm going to clamp everything over here now and disconnect it from my patient. I'm going to put it in one of these bags since it is a blood product, and we're just gonna dispose of it per facility protocol since you didn't have any reaction. If they did have a reaction, again, we would be sending this to the lab to get checked. And my patient is doing amazing, so I'm going to go document and do hand hygiene.